all heart call signs.
They're Britain's toughest medics.
Can you got any movement in your legs?
Just get me out!
We will be the people that are going in the direction of where something went bang when other people are going in the opposite direction.
He is armed at the moment with a knife.
The NHS's Hazardous Area Response Teams, HART for short, are trained to tackle the most critical cases in the most dangerous places.
This is moving, this.
Let's come out of there.
Could be someone in water, at height, underground, overcome by gas. Whatever it is, our team are there to access them and treat them in those environments.
Created after the 7/7 bombings, they're in the front line when terrorists strike.
There's always that risk of this could go wrong, and it could go wrong quickly.
It's been confirmed that it is a nail bomb.
Specially selected,
Have you seen how high up it is?
It's fallen from around 20 foot.
prepared for anything.
She's currently trapped in the car by her legs.
Massive intrusion into his cab.
Never filmed before.
Shotgun injuries to his leg.
Go on, you have to blast me.
It's a job that calls for courage and skill.
We have got specialist kit, we have got specialist vehicles. People coming in from other agencies and they think it's like a scene out of Thunderbirds.
Hold it. OK, we need him on a board in a minute, on a collar.
Real life heroes, risking their lives to save others.
This is going to be a major incident. Hotel 1 to all heart call signs, quick update on this detail. It's now been passed that it's a van on its side with 2 people inside, trapped, 1 query unconscious.
The HART team are racing to a serious road traffic accident near Halifax.
Hotel 1 to all heart call signs, further update, 1 now cardiac arrest.
It's an alarming development. And with 15 miles to go, the HART teams hit a major traffic jam.
It's a problem now, mate, getting through all this.
It doesn't look good.
Football coming out time.
Three HART vehicles are on the road. With the daylight fading, they find a full-on emergency is underway.
Yeah, all good.
Extreme station. Captain.
The air ambulance crew has just arrived with a doctor on board. They're treating a patient in the road. One of 2 brothers pulled from a badly damaged van by fire crews.
Sorry, Doc. I don't know if it's your thing. Are you thinking RSI or anything with this guide? Just because if you are, we'll get it ready, that's all.
The other one's on fire ambulance, he's walked on.
All right, okay.
Right, GCS6, so we've got the tube in. I'm going to RSI him, chaps.
Dr. Tim Moll will anaesthetise the patient at the roadside, a procedure only undertaken in cases of severe head injury.
So what I'm going to do, I'm going to get him onto the trolley.
Yeah.
We want to get him so his head's facing uphill on the trolley.
Yeah.
We'll kick them on his right hand side.
Okay.
And get on the tube. Okay.
Yeah.
28-year-old Joe English is unconscious and showing signs of catastrophic head and neck injuries. His life is hanging in the balance.
Hotel 1 to all heart team, yeah, confirmed we're going for RSI, so if we can get kit together please, and back up to where we were, and then we'll prepare for an RSI.
Team leader Tony and the rest of the HART medics will prepare Joe to be taken to hospital immediately after he's anaesthetised.
Got a pelvic splint as well, and we'll do it at the same time as we scoop him.
What we've got is a van that's overturned. As for the reason or the cause of the actual van overturning, we don't know yet, because it looks like a single vehicle that's been involved. 2 people inside. One is walked off and got into an ambulance by himself. The other gentleman is got head injury, along with some other injuries that we're not quite sure about just now. So there's a doctor on scene from Helimed, and he's chosen to do the rapid sequence induction, so he's going to intubate the patient. So to do it safely, we're going to set up what we call an RSI and then assist in ventilating and securing his airway. They're setting it up just where trolley is now. They're going to do it so his head up road, so they want it setting on his right hand side, so our left hand side as you go on the road. All right.
Okay.
Sorry, buddy, can I just pinch you for a second? Just hold this in place, is that all right?
Time is of the essence. Medics fear Joe has a significant bleed on the brain. There's a danger it's creating pressure inside his head. It can kill in minutes.
Right then, and then very, very quickly I'll just bob that one up there.
An anaesthetic will slow the bleeding down and could be the difference between life and death.
It has to be as calm as possible, but everybody really needs to know their role. It is a different environment, but it's one where the team themselves have practiced it a lot because it is such a serious clinical skill. They need to be well prepared and well trained in doing it.
Can you get me to the mortar, please?
What size blade do you want, Doc?
The biggest one.
Everybody ready?
Yeah.
Okay, on move. Ready, steady, move.
In fading light, the team has set up what amounts to a roadside operating theatre.
Can I just take the airway, please?
Of course you can, mate, yeah.
Thanks.
So,
let's get the collar off.
Yeah.
A little bit quiet, please.
Pre-oxygenation in progress.
We are pre-oxygenating.
Spare O2 cylinder immediately available.
We do have a spare O2 cylinder. Yeah, check.
IV IO access.
Check.
IV's running.
Yeah.
Resuscitation drugs immediately available.
Check.
Every step is critical. They've only got one chance to get it right.
Right, so I'm intubating. Fendi is doing inline stabilisation. We've got a monitor over there. We've got a chap doing the cricoid. Lady squeezing the fluids in. And I've got my assistant here to pass me all the stuff.
Yeah.
All right, check. Right, guys, we're going to do the RSI now, okay? Okay, so drugs are going in.
They are going in.
The anaesthetic will put Joe into an induced coma.
Is it going in okay?
And confirm all drugs in.
Thank you. Give me the bougie.
A tube is guided down Joe's throat into his airway.
Got a good view. The bougie's through the cords. Put the tube on the bougie, please.
Medics can then take over breathing for him.
Bougie. We're going to advance the tube through the cords. Remove the bougie, please. Okay, cuff up, please. We've got CO2. Sammy, please hit blood pressure. Cricoid off, thanks. You can stop holding the head. Cool. So well done, guys.
Joe is successfully anaesthetised. They can now get him out of here.
To DCA in the helicopter, are we?
We're going in the DCA to the helicopter.
Right, we'll just do it nice and steady.
Okay.
A short journey by ambulance will get Joe to the waiting helicopter. He'll then be flown to hospital.
I'll just keep an eye on his airway for now.
Just gonna give man down at the other end, mate. All right, cool.
See you down there.
Yeah.
His condition in the ambulance remains critical.
So you think possible
I think he's had
brainstem?
Yeah. So he may have been driving his van, had some sort of stroke for some reason, smashed it up.
Aha.
You ready to move?
Yeah, ready, steady, move.
Is that on the outside?
Stand by, stand by. Cables.
The crash inflicted devastating injuries on Joe, but the cause is a mystery.
At this time, a single vehicle travelling towards Halifax is in collision with the central reservation. It appears to flip over, hitting tree, and then pushing another car into a further tree.
Whatever the cause, the impact of the crash has left Joe fighting for his life.
He's had a pre-hospital anaesthetic, which they'll maintain all the way to the major trauma centre. I believe he's going to Leeds at this time. So they'll keep him in an anaesthetised state to manage predominantly his head injury, so his intracranial pressure and his CO2 that they'll manage through ventilation. Once he gets into hospital, then obviously he'll go off for the most appropriate scans, try and figure out exactly what's going on, and obviously if it's appropriate, he'll then go off and have surgery.
Joe has suffered catastrophic injuries. The trauma team is standing by at Leeds General Infirmary and will do all they can to save his life. It's Friday lunchtime in the centre of Leeds, but the city's waterfront is unusually quiet. HART have been called in to back up emergency services dealing with a bizarre incident.
We've got a male who's fishing in the river there in Leeds, centre of Leeds, with a magnet. He's managed to pull up an old Boer War shell that's full of ball bearings. What we need to do is get this ball bearing shell somewhere safe to detonate it.
An army bomb disposal team have confirmed the 100-year-old mortar bomb is live and unstable. The men who found it are lucky to be alive.
We got here for 9 o'clock this morning, and just after 11 o'clock, my mate Dave got quite a big catch and thought there's something big here, and it turned out it's a Boer War mortar bomb. I rung my lad who's in army at Carrick, and he says, get me a video of it. So I put it on video cam and showed him, and he went, Dad, fuck police and bomb squad.
Dave's catch has sparked a major emergency operation.
Police sergeant came first, and he took control at scene. He got photographs of me and Dave, he got some videos, and then we compared them with other ones that were online, and then he got logistics card here.
Setting the bomb off here among the plate glass office blocks could cause thousands of pounds worth of damage and risk casualties. The Army have a plan.
At the moment, EOD are trying to put the shell onto the back of a vehicle to transport it to a local park, which has been secured by the police, at which point we're going to detonate the shell, hopefully, with nobody in its radius.
The bomb has been loaded onto the truck, and Andy and the team are about to join the slowest blue light convoy the city has ever seen.
Hotel 1, 1026. Convoy is leaving Crown Point.
Yeah, 26 received. Police are starting to clear this large grassed area up at the top of Victoria Ave. So we're just up here at the moment, helping them with a bit of crowd control.
Yeah, thanks very much. Just to confirm, convoy is now moving over.
The Army have warned the slightest jolt could set off the bomb. A soldier is driving the truck, and police have tried to clear the route.
I mean, all these cars are close to it, aren't they, if it did happen?
You worry when you think, well, don't go so slow, you see bombs coming van behind you, you think, oh, hang on a minute.
It's a 3-mile drive to the park where the bomb will finally do its work, more than 100 years after it was made. Police have evacuated the area.
That sort of size device, looking at a 200-metre cordon, so roughly 200 metres from the device itself and from the lorry. It'll be covered in sandbags, I believe, before the detonation, just to add further protection and mitigation when the explosion occurs.
The man who should be driving the van is happy not to be behind the wheel today.
Day to day I work for council, do potholes during the day, filling them up, making roads safe, and I do a standby afterwards. The standby can involve lots of different things, and this is one of them. Where there's been something found in the river. It's caused a lot of grief and a lot of disruption to city lights. They need me to collect the vehicle, what they're borrowing at the moment, to deliver sandbags to military, so they can do their job, and I'll take it back.
The bomb has now been gingerly lifted off the truck and surrounded with sandbags to absorb the blast. The Army are placing a small explosive charge on it.
Happy?
Unusually, Paramedic Tim is being allowed to press the button.
Right, so that'll start flashing red. 1, fire. Hold 1. Hold 1. Yeah, then press fire.
Thank you very much.
There you go.
Nice one.
No worries.
Mortar bombs were designed to kill and maim troops on the battlefield. Thankfully, this one only damaged a few sandbags. At HART headquarters, Roshers is maintaining the team's breathing apparatus. It's used when they're working with the fire brigade to protect them from smoke.
It's annoyingly heavy, it's very cumbersome, and it gets very hot and very hard working very quickly. So you've got to keep on top of your fitness to be able to use this stuff at all times.
Lives can depend on this kit working properly.
All the training we do here is dangerous no matter what discipline, but we try to train hard, fight easy, if that makes sense. If you train to the extremes, hopefully you'll never get to that. You'll recognise things before, and so you can get yourself out of them situations, and that's what we try and do within all the disciplines that we do on HART.
In Bradford, police have sealed off a street in the city centre after a man climbed onto the roof of a 4-storey building. HART have been called to stand by in case he falls.
We've got a male up on a roof and he's threatening to jump. Police have been on scene quite a while now and they're not getting anywhere with him, and he is saying that if they come any closer he's willing to jump. So we've come in preparation of him jumping off the building.
It's a tense standoff. A police negotiator is talking to the man, with no results so far.
Who knows what's going on inside his head, really. He's just a bit erratic, so I think a few times he's running and stopped at the edge, and then looking over, like he's gonna do a bungee jump, if you like, but he's not doing a bungee jump, is he? So.
Police hope the cold may persuade the man down and he can be given the help he needs. But elsewhere in Bradford, there's another emergency.
We've got a 10-pump fire in Bradford, so they're going to draw us off here, send us there, yes, in Bradford area.
10 pumps means 60 firefighters are on their way to battle a major blaze in a disused mill building. HART are joining them. It's a high-risk incident.
Water's on fire, you know, it's the chemicals involved, there's the people involved, there's people inside. Majority of big fires that's what we go to, that I've been to, are usually derelict buildings, like old, especially around this area, old mills and things like that have got fire.
Victorian timber in the roof is ablaze, and high winds are fanning the flames.
It's looking like a derelict mill. Right. We've turned up, 100% involved. Right. So we requested some aerials, as much water as we can get on, to protect our exposure risk.
Are you happy that these are evacuated down here, these buildings, or do you want us to start knocking on doors?
You don't mind, yeah.
Thick smoke is billowing across much of the city.
You guys happy just to do a door knock from Willie Mill down? He's not convinced that they're empty yet. Just get everybody out, get them out of the way.
HART's job is to protect local people and firefighters.
We're not getting any reports of people inside, but we don't know what is in there, if there's any chemicals. Fire and rescue are just getting set up as we speak, so really it's early days on this one. Massive risk to firefighters, so nobody's going inside, they're just going to safely deal with it from outside right now.
It's early evening, and nearby shops are closed, but there's concern families may be living above them.
What's all for? Yeah, intel from police, they're all empty. So, happy days, just leave it be, mate.
The light is fading, and firefighters are preparing to enter the building. The risks are increasing.
Top floors, isn't it? They said it's all top floors at the minute, yeah. The roof's 100% engaged. Right. They don't know about lower floors, but obviously they're just trying to get as much aerial water on it as they can to try and pull it back. It has broke through from third floor down to the second, but not massively. You're like a pack of cards if it goes though, can't it? You know, if the floor drops or something like that.
But the age of the building suggests it may pose a further threat to the public.
You assume there's asbestos in there, obviously lots of timbers in the structure. As for anything else in there, we just don't know. HART have hazmat advisors, and Dave Lum's my hazmat advisor today on team. So he's talking to Public Health England just to give him a heads up about the smoke plume, what's underneath that, what may be in it, and what we do is we advise local GP surgeries that they may get an increase in people coming in with chest conditions, chest complaints, particularly those who've got an existing condition and may just feel they get it a little bit worse. So it's just to prepare them for what might come in the next 24, 48 hours.
Inside the building, the fire is still raging. Mill fires are very common in West Yorkshire. Many are derelict, although some have been converted to other uses. This one is almost 200 years old, but demolition is its likely fate.
The way the wind direction's taken the fire means that it's still quite active on the far side of the building to us. So although it looks like it's well dealt with from this side, it is still quite intense on the other side of the building. So we're now going to hand over to our night team, and they're going to stay on scene and look after the firefighters while we're relieved and get home.
The risks have led to fire officers ruling out entering the building. HART must remain until the flames burn themselves out. Every month, around 2,000 burglaries are committed in West Yorkshire, and most of the people behind them will not be caught. But tonight in Leeds, one fleeing suspect needs help.
We've got a call for a gentleman that's cut himself with a knife and then he's jumped out of a two-storey window. Man is on scene now. I think police are on scene as well. And all we've got is that he's bleeding from his head.
Church is leading the convoy. The incident has happened in a vacant factory building close to the HART base. Their patient was in a second-storey office when he accidentally set off the fire alarm. He threatened firefighters with a pair of scissors, then tried to jump from a window when police arrived.
Listen, blow off with the wind blowing, alright? It will wear off.
Police used pepper spray to subdue him.
Have you taken anything at all?
He's handcuffed, but still resisting.
It will burn, so you have to relax.
Team leader Manny fears he's broken his neck in the fall. He also has a head injury.
We know he's come out of probably a bit more than a two-storey window. Landed on his head. Fire service have been here, police have been here before we've arrived. We found him in the care of the fire service and police. He has been parved, so I'm not sure exactly what's taking place with the police. However, we found him. He's not 100% compliant. I'm not sure exactly what the circumstances are there, whether it's trauma-induced or it's just due to the circumstances of the police being here and all.
Right, Lou, I'm going to move this out of the way.
Paramedic Lou is trying to calm their patient.
We need to just protect it and keep it straight, okay?
If he has broken his neck, one movement could paralyse or kill him.
Sorry, buddy. That's a good lad.
One sec. Yeah, okay.
It's vital he's immobilised on a spinal board as soon as possible.
Just to keep it nice and still, all right?
On your call, Lou.
Okay, everybody got a bit?
Yep.
Your legs, mate.
Okay, ready, steady, roll. Hold on, matey.
Yep.
Ready, steady, move. Right, can you lay your head
Local firefighters are attacked twice a week on average, and ambulance staff aren't immune from violence.
We'll get people fighting, we'll get people taking collars off, throwing things, refusing to have treatments that we're going to give them, and basically refusing to help themselves and making the situation worse for us and for the police as well. And it's becoming much more common now.
I know, once we're in the ambulance where it's a bit warmer, we'll cut your clothes off that have got this pepper spray on. We're going to have another listen to your chest and I want you to take some nice big deep breaths.
The man was hanging from the window and being physically held by police officers when he slipped from their grasp.
Have we got any access in him?
Now his condition appears to be deteriorating.
What's that?
That's dropping as well.
Let's get him inside. Yeah.
The man's SATs, the oxygen levels in his blood, are dropping. It's a worrying sign.
What did you land on when you landed? Can you remember? You landed on your head. Can you lift one of your legs for me? Your left or right, whichever you're more comfortable doing. Right, just keep your head back down.
Right, that's fine for the time being. Let's take that off and let's just get him inside. Yeah. Everyone got a corner? Yeah. Happy on lift then. Ready, steady, lift.
The light is fading and Manny wants to examine the man more closely.
And down we go. Right, let's get him inside.
He's becoming less responsive.
Yeah, just doing his legs.
Can you feel me pinching your leg? Can you feel that?
Their examination reveals his head injury is more serious than it first looked.
You know what's going on? You know who we are? You know where you are? You don't know.
It's decided to make an immediate dash for the regional trauma centre.
We've realised that it's a life-threatening injury, so we've just literally sat in our hands and ran to hospital with him. Because he's cuffed, we couldn't gain any IV access. There are times where you need to stay with your patient and work on them, and then there are times when you just need to run with your patient and they just need to get to hospital.
Leeds General Infirmary is a 5-minute drive. The suspect will go for immediate scans. Police will remain by his bedside. Outside a petrol station near Leeds, there's been a major accident, and Bravo team have been scrambled to provide medical care for a trapped driver. But the tailbacks are delaying paramedic James's arrival. 2 vans have collided head-on, and tradesman Andy Woodcock is pinned behind the wheel of his transit. The other driver is also injured.
There's a lot of fuel, a lot of debris on the floor, glass, actually the engine bonnets and everything is absolutely just mashed, so a really high impact.
Firefighters have managed to cut the wreckage trapping the other driver. Both vehicles narrowly missed the petrol forecourt.
It could have been a lot worse, yeah. One of those vehicles being thrown into the petrol station. Obviously, you've got a risk from all the petrol there, but you've also got pedestrians walking around, people refuelling the cars, so it could have been a lot worse.
The team are preparing to remove Andy from his seat. It will allow them to assess his injuries properly.
We've got paramedic round the other side. Looks like leg injuries there. It doesn't look right well. But they look like we're going to have to spin him out this way, Paul, because there's not a lot of room there.
It's critical Andy's back is immobilised. He has a badly broken leg, but there are fears for his spine too.
I think with his injuries, we'll have him straight out through the door. The time critical, so we want to get him out, get him settled.
Andy's femur is broken. It can lead to catastrophic internal bleeding.
What do you think about the level of his injury? Is it life-threatening?
Potentially at the moment, yeah.
Firefighters are leading the operation.
Right, who's taking C-spine as he comes out here?
We've got a firefighter on the head at the moment, but then hand over at one.
Yeah, we'll need probably this gentleman here.
Andy must be moved with great care.
I've got his C-spine, yeah, I'm happy with that. Well done, fella.
Well done.
Lay yourself back, Andy.
Just lie down.
On 3. 1, 2, 3.
Paramedic James must reassure Andy. He's in great pain, but now they must straighten his broken thigh bone to reduce the chances of further blood loss.
Right, sir, my name's James. Can you hear me at all? Your right leg is broken, all right? So we're putting a splint on that, and we're going to get that all back in alignment.
Their patient has already been given ketamine, a very strong painkiller.
They need to just pull that, because at the minute there are bones which are in the wrong place, and that just pulls them back into shape. You're going to have some more ketamine, okay? So you're going to feel a little bit strange, but it should help with this pain, okay?
The team are using a traction splint to pull his leg back into line. An air ambulance doctor will supervise.
Airway's fine. Breathing seems fine. Good air entry bilaterally. Circulation is chest and abdomen are fine. Pelvis seems fine. It's got a strong radial pulse. It seems a little bit quick. I'm not measuring it, but it's probably about over 100 or so.
Andy was on his way to a job. By chance, he knew the driver of the other van.
Wife? Ring her. Have you got anything in the van with their number on?
It's on my mobile phone.
On your mobile phone?
But for now, Andy's medical condition must be the team's priority.
Just putting the splint on now. I know it feels like someone's trying to pull your leg off. We're pulling against your muscles that are trying to protect from the injury, okay? It feels horrible, but it is something we do need to do.
As well as one broken femur, Andy has serious injuries to his other foot, caused by the pedals of his van.
So Andy, what the plan is, you're going to be going in the helicopter. So we're going to get these 2 splints on you, and get you set up for flying, and we're going to take you up to LGI, okay?
Andy will need surgery.
Ready, brace, lift.
So we're taking him to helicopter now, okay? Then we're taking him to Leeds Infirmary. We're going to fix your leg at Leeds Infirmary. Got some very good surgeons there.
With both patients now on their way to hospital, thoughts are turning to what might have happened. In the Pennines, many local people enjoy spectacular views across deep valleys and rugged peaks. And some houses are built to make the most of them.
999 road activated.
HART are heading to Slowett in Kirklees.
What is this job anyway?
Very fallen head injury. They said the bedroom was sort of downstairs. You had to get up from the bedroom to get out of the house.
The team's muscle power has been called in by a local ambulance crew called to a serious fall. It's feared Betty Bray has broken her neck.
I was upstairs doing breakfast because we're in an upside down house, bedrooms downstairs, kitchen's upstairs, and she tripped on a blanket and knocked her head against the corner of a wardrobe, which I think is the main problem, and she felt cracking in the neck.
It's just the extrication really, primarily.
It's a potentially life-changing injury, and it's going to take all the team's skills and ingenuity to get her out of her home.
top up. Can you grab us a mids up to the vehicle? We've got a scoop down here though, so we just need the mids sorted. Okay, I'll fetch one down.
It's decided carrying Betty out of her home and up a steep flight of stone steps is the best route.
So what we're thinking is that's better than going up there with a turn up stairs. Right. But we've still got to turn down here to get through.
The spectacular views led Betty and her husband to move here. Now, the design of their home is a major problem.
So, what we're thinking is a few people sort of just gently support it and we actually sort of pull it up the slope. Yeah.
Sarah is trying to work out if Betty has tingling or loss of movement that might indicate a spinal injury.
I'll never have this again.
No.
Two fellas on my bed.
I'm just going to lower you down nice and gently, say if anything hurts.
It's vital she is immobilised until she can be x-rayed in hospital.
Is that okay?
Yeah.
All we're going to do is just roll you gently to one side. You don't need to do anything. You just let us move you, okay?
Okay, guys, I'll move again. Ready, steady, move.
She's being fastened to a scoop stretcher that will keep her back rigid.
It's a bit uncomfy.
It's a bit awkward.
Initially, I didn't think it was too bad, but then when we laid her on the bed, they were very concerned to keep her head totally still.
What's that, uncomfortable?
Very.
Wait, on your bottom? Yeah. Right, okay. We're going to just try and get this pillow out from underneath your shoulders a bit, okay?
In cases of spinal injury,
You just stay nice and still, Betty.
comfort isn't a consideration.
I can see she's in very good hands, but obviously you don't know exactly what they're going to find.
Betty was dressing to head out for lunch at a local farm shop.
Shall I put the collar on first and then I'll put that underneath?
Now, she's about to start a difficult journey to hospital.
Betty, I'm going to pop some headlocks on you, like big foamy emus.
Yeah.
All right.
I know it feels nice and a bit tight, but it's just so we can get you up the stairs safely. As soon as we get you outside, we'll take all this off again, okay?
Team leader Ned has a plan, but it's not going to be easy.
At the side of the staircase there's actually room for a couple of people and we'll just take her a sort of a step at a time, but at least the rope will hold her so that she's not going to come back down or anything like that, and we'll just gently see if we can just move her up. Obviously we've got to get around these corners first.
Betty is on the move.
Okay, Betty?
Falls are the biggest cause of accidental death in elderly people in the UK. Thankfully, she's in good hands.
And then dress over a little bit.
Stand down.
Now just standing up. Steady.
Your height.
The team practice extricating patients from confined spaces.
I can do one hand, but not both.
But Betty's hillside home presents multiple obstacles.
Yeah. Okay, standing up. Oh. Flower vase as well.
Sorry.
The team have their work cut out.
How's levitation? You okay?
Inch by inch, Betty is nearing ground level.
Slide upstairs, aren't we? You slide up? Yeah, probably best. Could do. Come on, it's getting a bit awkward, isn't it?
Yeah.
Yeah, do you want to put her on the stairs if you want? It saves your back.
Just going to take you up a step at a time, but you're going to be absolutely fine.
Ready, steady, slide. Ready, steady, slide. And one last pull. Ready, steady, slide. Up.
How are you doing there, Betty?
All right, thank you.
You okay?
Ready, steady, lift.
Betty is now on her way to A&E. She'd only just come home after treatment for heart failure. Her neck injury is potentially very serious. It's early morning, and Mike team are on their way to a village outside Doncaster.
We've got somebody in the house saying they've got a bomb and methane, canisters of methane, I believe.
The man is holed up in his house and is threatening to blow himself up. Police are already on scene. A major drama is unfolding in what is usually a quiet street in the small village of Scawthorpe. The area has been sealed off because of the risk of a gas explosion. Police are trying to talk to the man inside. He's extremely agitated.
He's got a little fire going in front garden. Apparently he's been in the window with some sort of gas canister and something that looked like it. But they don't know exactly what he's got in there. But for the time being, obviously, they're just negotiating with him and having to treat it as sort of a credible threat.
As more details of the man's difficult circumstances come through, it's clear he's desperate and also dangerous. Police fear he is flooding his house with gas. If he carries through his threats to ignite it, the resulting blast could cause devastation.
If an explosion happens, we have to worry about the blast, fire and flying debris. At the moment, all the residents are still in situ in their own properties, just being advised just to stay in and just keep away from the doors and windows, just due to what's going on.
As the man's threats ratchet up, HART and the other emergency crews are getting ready to enter the house, despite the chance it may be filled with gas. Medics can only wait, while trained police negotiators try hard to talk the man round. But the atmosphere inside the house is highly charged.
Police negotiators have got a really difficult job. One wrong word and that can be, after all hard work they've done trying to gain the trust and calming them down, it can just be back to square one again, which often happens. So sometimes you can be sat there for hours, but you're always hoping that they manage to do their job and get everything out safely.
But after 3 hours, there's positive news.
Police negotiators have made good progress speaking to the patient. The patient's managed to make his own way into the ambulance, so he's given himself up to the police. So from here onwards, he's in the care of the ambulance service, the NHS. So we'll be taking him to be assessed by a trained psychiatrist.
At last, life in the village can return to normal. Negotiation has once again diffused a tense situation, and there is a tangible sense of sympathy for the man at the centre of the standoff. He is now on his way to hospital, where he'll be offered psychiatric help. It's midwinter.
999 road activated.
An Alpha team are heading out into the gloom of a December morning to help out an ambulance crew in the woods. It's dawn, and for Alex, it's too early.
I got to that point where I was just nodding. Just have a little half hour on a Sunday morning here. Oh well.
They're heading for the suburb of Meanwood.
Some bowling in some woods. I'm not sure what EV they've got at the moment. It's apparently it's difficult access.
10:21. Andy's just gone to have a look and liaise with the crew on scene and find out what they need from us. So he's just disappearing in the distance.
The team's patient is Karen Sternbach, who was walking a friend's dog when she fell and broke her ankle.
Ah, that's very sharp on the inside of my ankle. No, it's fine.
She urgently needs hospital treatment. Her ankle is also dislocated. It's an injury that, left untreated, could lead to the loss of her foot.
We'll make a little stretch, just put you on
goes
scoop.
in down the side.
Yeah, you've seen him, haven't you, on TV, yeah?
One.
And then we'll take you down the steps here, get you to the back of the ambulance, okay?
What's up, 3? Do you want to come give us on with that?
I'm already on my way.
Her wellies are supporting her injury.
Fitted boot, it's splintered, you can feel a foot, so
right.
I thought we'd leave
I've had to leave it.
They are warm.
Right.
So I can actually go out in these without socks on.
She's got some fairly sturdy boots, so we're happy to maintain splintage at the moment. And we have got a splinter pay if we need it. But yeah, just a scoop on mid, please, over.
Karen has been given gas and air to dull the pain, but she's been sitting here so long, she's finished an entire bottle.
I don't think there's any left. I think I've emptied that one.
Karen's getting colder. The team want to move her to the ambulance as quickly as possible.
Have you been all right on this gas and air?
Yeah.
Do you want some more? We've got another bottle here. Please. Yeah.
It's feared bone fragments have pierced her skin. She may need surgery.
Oh, I don't lift it, please.
Right.
It's sharp. It's sharp. It's
Alright.
sharp in front of my ankle.
Oh, right, so you've gone. I was going to say, it's not me.
Ironically, Karen was dog walking for a friend who had to go to hospital.
In your own time, just lay back. You can keep going with that while you lay down, it's all right.
Soon she'll be following him to Leeds General Infirmary.
Are we ready?
Yeah.
Ready, steady, lift.
Here we go.
Karen's being carried down the muddy track that caused her fall back to the roads.
I can feel it going. You all right?
Yeah, it's just really slippy underfoot, so we're nearly there now.
Team leader Andy's relieved to have Karen at the doors of the ambulance.
We've got plenty of hands around the stretcher to help to extricate. We had one or two members of staff manage to slip and slide a little bit, but we got down in a safe fashion for the patient. Andy's optimistic. We've not managed to have a really good assessment of the leg yet. It's well spaced in the boot, so we've left the boot on for the time being. But she can feel her feet, she can move her feet, so we're happy there's no sort of nerve damage. Hopefully get to hospital, maybe a little bit more pain relief when she's warmed up, and be able to extricate that boot and assess her foot better. She seems in good spirits, so hopefully she'll be fine.
But Karen's case turns out to be much more complicated than the team realise. Her fracture dislocation required extensive surgery, and she was forced to spend Christmas in hospital. It affected her mobility, and for a time she had to move in with her parents. Van passenger Joe was left paralysed from the neck down after severing his spinal cord in the crash that also injured his brother. He's now set up a charity to support patients like him. The Canal and River Trust has issued warnings about the dangers of magnet fishing after the bomb scare in Leeds. The man on the roof in Bradford was talked down, and no firefighters were injured in the mill fire. Police questioned the suspect injured in the alleged office burglary. It's not known how serious his injuries were. Van driver Andy suffered 6 fractures to his foot, and surgeons used a metal rod to repair his broken thigh bone. He was in a wheelchair for 4 months. Pensioner Betty was found to have escaped with bruises after a fall in her upside-down house, but she was later readmitted to hospital for open heart surgery. And the man involved in the standoff near Doncaster was sectioned under the Mental Health Act.